So first, in pathology, we are beginning with stains. So here, if you can see, you have different types of material and the different types of stains used for different types of material that you can see in cells and the different stains used for the same. So for amyloid, you have Congo red, carbohydrates, you have Alshin blue, PAS. PAS stands for periodic acid shift. And you have rapid mucin. Then for neuronal tissue, you have Luxol fast blue, cressyl violet, and triglyceride, you have oil red O. Reticulin, you have reticulin stain. Then connective tissue, you have Van Giesen. Then you have Gomori trichome. And then Mason's trichome. Then again, some important things are your AFB staining for your nuclear mycobacteria, etc. So let's take images one by one. The first one is you see some red color stain. So if it is a red color stain, there are two common stains with red color. The first one is alizarin red. So your alizarin red, it is used for calcium, and you have oil red O that is used for fat. So you see a stain with a red color. So the importance of studying stains is that probably for your exams, your question is not going to be a direct question which is saying what is the stain and what is the color or something like that. But in the question, you will have maybe some substance that has been stained, and that is the image that is given. For example, in mucin, you will have some musicarmine stain or some alshin blue stain, and you are asked to identify what the stain is. So the question is going to be something like that. Similarly, if the answer has something to do with fat cells, either there will be a stain with your Sudan black or your oil redo, and you are asked to identify what the substance is and what the stain is. So that is the sort of questions that you have to expect. So first is a red color stain. So either it is alizarin red, which is calcium, or oil red O, which is fat. But here you can see you have some big cells that have been stained. So the chances of it being oil red O are more. Again, this all depends on what the question is and what the examiner expects you to know. So here what I want you to know is you see a red colored stain. Either it is going to be alizarin red, which stains for calcium, or it is going to be oil red O, which stains for fat. Okay, and depending on the circumstance of the question, you have to identify which one it is. Now, second, again, you can see cells having some dark colored, black colored substance. So this black stain is going to be your Sudan black. All right. Sudan black. That also stains fat. Now here, what are you seeing? So you are seeing you have seeing cells which have taken up a very light or bright blue color. So if it is a bright blue color, it can be many stains. That is, it can be toluidine blue, it can be it can be toluidine blue, it can be alshin blue, or it can even be luxol blue or anything like that. But now that you're seeing a bright blue stain that has stained almost all of the structures, the chance of it being Alshin blue is more. Again, if the question says, that is the question, circumstance of the question is such that you are expecting a carbohydrate or a glycogen disorder or liver tissue or something which has glycogen, you have to think of Alshin blue. Now, this Alshin blue can be used for carbohydrate and also it can be also used for mucin. Okay. Now next one is, what do you think this is? You have a substance in which has taken a light blue color, and it is a fibery like substance. Like it has something of a fiber consistency. So it is most likely to be collagen that has taken the stain, and it is likely to be Mason trichome stain. Now this Mason stain, I want you to know there are two types of Mason stain that is commonly used. That is Mason trichome for collagen and Mason fontana for melanin. So this Mason trichome, this light blue color, is taken up by collagen. Now here again, this is some other substance which has taken stain, red color stain. Now when you are comparing with this with the first color, first stain, here in the first image you have you have a big substance that has taken stain. On the other hand, here there is a small substance. So it is likely to be alizarin red, and the substance that has been stained is likely to be calcium. Okay. So here, as I said earlier, this is a skin tissue. You can see you have some cells which has taken a black color stain, but only in a particular area, or one single layer of cells seem to have taken stain. Now, as I said, this is a skin biopsy, and in a skin biopsy, you have to understand that in the dermoepidermal junction, you have a layer of melanocytes. Okay, you have a layer of melanocytes. So this black stain has been taken by melanocytes, and earlier I was telling you about Mason trichome. So this is going to be your Mason fontana for melanin. Okay, so coming down here, you are again seeing a substance that has taken stain, and this is supposed to be a vessel. Okay, and the vessel, the surrounding lamina has taken stain. So that is elastin is what has taken stain, and it is somewhat of a blackish brownish color. So the stain that has been used here is Van-Giesen. Okay. Now next picture, what do you see? So here you see a substance, or rather some cells which has taken stain, a bright magenta stain. You see this bright magenta, you have to think of PAS, that is periodic acid shift. Okay, so moving on to the next image. Here again you are seeing some black tiny granular material. Okay, this black tiny granular material. So that is likely to be calcium, and the stain that is used here is your von Cosa stain. Okay. Next image, again you have a epithelium. Why am I saying it is an like you have a lining which you have an epithelium which has been lined by some cells containing, I am saying this is mucin. Now why am I saying it is mucin? I'm saying it is mucin because this is an epithelium, and in epithelium, you know, you have your intestinal epithelium which has lot of mucus glands. So this epithelium reminds me of such mucus glands. So I can say it is mucin that has taken stain, and this stain is your mucicarmine. Okay. Now moving on to the next picture. So this picture, actually this is a nerve. So here It is just a dark blue stain. And as I said earlier, whatever stain it is depends on the circumstance of the question. So it can either be something like a toluidine blue or even Luxol blue, which is used for nerve fibers, or it can even be methylene blue. This particular one is something I have taken of toluidine blue. Okay, then the last image, again, you are seeing blue, tiny, granular material. So what is it going to be? So this blue, tiny, granular material is likely to be iron, and this is your Prussian blue stain. I hope that much is clear. So let us take a look at a few of the tables. So you have acid-fast bacilli, that is the Zn Ziehl-Neelsen stain, or you have acid-fast AFB stain. Then Giemsa, it is used in to color, to stain bacteria or blood elements. So this Giemsa, as far as a question is concerned, how the question is going to be framed is, there is a patient who has taken antral biopsy, that is endoscopic biopsy from the stomach, and some in that biopsy in H&E you see tiny rod like organisms. So which is the stain that can stain these tiny rod like organisms? So these tiny rod like organisms are your H. pylori, and the stain that can be used is your Giemsa. Okay, so that is the condition in which your Giemsa stain can be used. Then again, toluidine blue, Steiner for H. pylori, then PAS for fungi. You just have to learn this. Then PAS, you have glycogen or neutral mucin, Alcian blue for acidic mucin. Then Congo red. So amyloid, stains for amyloid. You have Congo red. Then you can also have thioflavin S. That can also be used, and chrysal violet. These are all stains for amyloid. Now, the normal stain is Romanowski stain. So what do you mean by Romanowski stain? So the word Romanowski essentially means that it has an acid component and a basic component, but the dye itself is neutral because it has both acidic and basic components. So these are the materials which are used. Then here, von Cosa for calcium, alizarin red, Prussian blue, Faucet's reagent for bile, and Orcine rhodamine for copper. Okay. So what do you think this is? What do you think this picture represents? So you can see it is an orange colored, I am guessing, stain, and some of you might feel that this is a picture of a volcanic lava eruption or even that of space, but I can tell you this is DNA that has been stained, and the stain that is used is acridine orange. Okay, now we are done with stains. Now let's move to the next question, that is giant cells. So what are the most common giant cells that you know? You have the Langhans giant cell that is seen in TB. So in Langhans giant cell, what do you see? You see horseshoe shaped appearance of nuclei. Then you have your two-tone giant cell. Now there it has some cholesterol or fat inside, and the nuclei are arranged something in the form of a circle. Then you have this particular thing that is called the Warthin Finkley giant cell, and it is seen in measles. Okay, so next here, as you can see, you have a two-tone giant cell with a lipid halo. And what is the next? So these are your Langhans giant cell. Then these are your tumor giant cell. Now, why am I saying it is a tumor giant cell? I am saying so because if you can see, when you compare nuclei in this particular case and this particular case, here the nuclei are more or less even. They are regular, they are uniform, they are even. But here, if you can see, you have a large cell with extremely hyperchromatic nuclei, and the individual nuclei are all different from one another. That is, they are pleomorphic. So that is a type of giant cell that you see in a tumor, and it is called tumor giant cell. Then what are the other giant cells that you know of? So you have Langhans giant cell, Totten giant cell. Then you can also have foreign body giant cell. Now this foreign body giant cell, again, there will be uniformly arranged nuclei, and this may contain fragments of your foreign body inside. Usually it is either suture material or it is your talc or something like that. So that is it about giant cells. Now coming on to the different type of chromosomes. So if this is a chromosome, you have the centromere, the short arm, that is the P arm, and the long arm, that is the Q arm. So your short arm is P arm because it stands for petite, that is small. And Q comes after P, so long arm comes after short arm. And these are your telomeres. So you have different types of chromosomes depending on the position of the centromere. So you have metacentric, submetacentric, acrocentric, and telocentric. Okay. Now, are you able to identify what this is? Here you have some sort of an inclusion wherein you have a halo. Halo essentially means there is a clearing and a dark nuclei. Here also you can see something like that. So you have a clearing and then you have a hyperchromatic nuclei. So this is usually seen in your cytomegalovirus, and this is usually seen in herpes. These are the Cowdry A bodies seen in herpes infections. So here, as you can see, you have a Cowdry A body, which is a large intranuclear inclusion body surrounded by a clear halo. So herpes simplex virus, HSV, you will have two types of inclusions. One is Cowdry A and one is Cowdry B. So this Cowdry A, you have eosinophilic nuclear inclusion, and this Cowdry B, you'll have some ground glass material. Now we are moving on to LE cell. What is an LE cell? Now an LE cell is a macrophage that has engulfed nuclear material of another cell.